Hello everyone, welcome to our channel today. We're diving into a crucial topic that often goes unnoticed, but can have significant consequences: fatty liver disease. Our liver is a powerhouse organ that plays a vital role in keeping our body in balance. But what happens when this unsung hero starts accumulating excess fat? That's where fatty liver disease comes into play. So, what exactly is fatty liver disease? In simple terms, it's a condition where fat builds up in the liver cells. Now, a small amount of fat in the liver is normal, but when it exceeds a certain threshold, it can lead to inflammation and potentially more severe complications. Now, let's talk about the signs that could indicate fatty liver disease. First on our list is right shoulder pain. If you've been experiencing discomfort or pain on your right side, especially around the shoulder area, it could be more than just a muscle strain. Now, we've all heard about fatty liver disease, but did you know it can send signals to unexpected places, like your right shoulder? Pay attention to abdominal discomfort and bloating. Your liver is located in the upper right side of your abdomen, and as it becomes fatty, it might cause pressure and discomfort, sometimes radiating to the right shoulder. Fatigue and weakness are common symptoms of fatty liver, and these feelings can extend to the right shoulder. Your liver is working overtime to process fat, and it might be sending signals through your body. It's essential to rule out other factors contributing to right shoulder pain. These can include issues like gallbladder disease, rotator cuff injuries, and even heart-related problems. If you're experiencing persistent shoulder pain, consulting with a healthcare professional is crucial for accurate diagnosis and appropriate treatment. This pain is often described as a dull, aching sensation and is known as referred pain, since it originates from one area but is felt in another. Moving to number 2 on our list is abdominal fat. To comprehend the relationship between fatty liver disease and abdominal fat, we must first understand each of these conditions individually. Fatty liver disease, also known as hepatic steatosis, occurs when there's an abnormal accumulation of fat within liver cells. This condition can result from various factors such as excessive alcohol consumption or metabolic disorders, including obesity. One key factor linking fatty liver disease and abdominal fat is insulin resistance. When the body becomes resistant to insulin, a hormone that regulates blood sugar levels, it leads to an increased release of insulin. This excess insulin promotes the storage of fat, especially in the abdominal region. This fat accumulation in the liver can exacerbate the development and progression of fatty liver disease. Inflammation plays a crucial role in both fatty liver disease and the expansion of abdominal fat. The excess fat stored in the liver triggers inflammation, which can contribute to insulin resistance. Simultaneously, abdominal fat cells release inflammatory substances, creating a vicious cycle that further promotes the development of both conditions. Next up on our list is visceral fat. Let's begin by revisiting the fundamentals. Fatty liver disease, or hepatic steatosis, transpires when an abnormal accumulation of fat occurs within liver cells. This condition arises from various factors, such as metabolic disorders and excessive alcohol consumption. Now, let's explore how it intertwines with visceral fat. It's crucial to recognize that the link between fatty liver disease and visceral fat extends beyond cosmetic concerns. Both conditions elevate the risk of severe health issues, including cardiovascular diseases, type 2 diabetes, and liver complications. A holistic approach to health, emphasizing balanced nutrition and regular exercise, is imperative to address and prevent the progression of these interconnected factors. A pivotal player in this connection is insulin resistance. As the body becomes resistant to insulin, a hormone orchestrating blood sugar regulation, it prompts an increased insulin release. This surplus insulin, in turn, stimulates the storage of fat, especially in the visceral fat deposits. Insulin resistance creates a cascading effect, fostering the growth of both fatty liver disease and visceral fat. The excess fat stored in the liver triggers inflammation, amplifying the insulin resistance we discussed earlier. Concurrently, visceral fat cells release inflammatory substances, creating a reciprocal relationship that perpetuates the progression of these intertwined conditions. At number 4 on our list is petit edema. Let's start by defining our terms. Peripheral edema refers to the abnormal accumulation of fluid in the peripheral tissues, typically in the legs, ankles, and feet. It's a common manifestation of an underlying health issue and often presents as swelling, aching, or a feeling of heaviness in the affected areas. The link between fatty liver disease and peripheral edema lies in the liver's role in maintaining fluid balance. When the liver is compromised due to fatty liver disease, it may struggle to produce sufficient proteins, such as albumin. Albumin is crucial for regulating fluid distribution in the body. The reduced production of albumin contributes to fluid retention in the peripheral tissues, leading to edema. Additionally, liver dysfunction and fatty liver disease can compromise blood circulation. This compromised circulation can result in increased pressure in the veins, further contributing to fluid leakage into the surrounding tissues. The combination of reduced albumin production and compromised circulation creates a conducive environment for the development of peripheral edema. It's essential to recognize the signs of peripheral edema, such as swelling, especially in the lower extremities. If you're experiencing these symptoms and suspect a connection to fatty liver disease, it's crucial to seek medical attention promptly. Addressing the underlying liver condition is key to managing and mitigating peripheral edema. Next up on our list is low thyroid function. First of all, let's clarify what we mean by low thyroid function. Low thyroid function, also known as hypothyroidism, occurs when the thyroid gland doesn't produce enough thyroid hormones, impacting various bodily functions. This can lead to symptoms such as fatigue, weight gain, and sensitivity to cold. Now, on to fatty liver disease, a condition characterized by the abnormal accumulation of fat within liver cells. As we've explored in previous, fatty liver disease can result from factors like metabolic disorders and excessive alcohol consumption. The link between fatty liver disease and low thyroid function lies in the impact of thyroid hormones on metabolism. Thyroid hormones, particularly thyroxine, T4, and triiodothyronine, T3, play a crucial role in regulating the body's metabolic rate. When thyroid function is compromised, as in hypothyroidism, the metabolic processes slow down, contributing to weight gain and potentially exacerbating fatty liver disease. Conversely, fatty liver disease can influence thyroid function. The liver is vital for converting T4 into its more active form, T3. However, in the presence of fatty liver disease, this conversion process can be impaired. The compromised liver function can hinder the conversion of T4 to T3, leading to a decrease in active thyroid hormone levels. The interplay between fatty liver disease and low thyroid function is complex. Both conditions can contribute to a cycle of worsening symptoms, such as fatigue, weight gain, and metabolic dysfunction. Understanding this connection is crucial for a comprehensive approach to managing and addressing these health issues. Moving to number 6 on our list is constant fatigue. First of all, let's clarify what we mean by constant fatigue. This goes beyond the usual tiredness and is characterized by an ongoing sense of weariness, lack of energy, and an inability to regain vitality even after sufficient rest. Now, on to fatty liver disease, a condition marked by the accumulation of fat within liver cells. As we've discussed before, fatty liver disease can stem from various factors such as metabolic disorders and excessive alcohol consumption. Now, on to fatty liver disease, a condition marked by the accumulation of fat within liver cells. Insulin resistance, often associated with fatty liver disease, contributes to the fatigue equation. When the body becomes resistant to insulin, there's an increased demand for energy to compensate for inefficient glucose utilization. This heightened demand, coupled with compromised liver function, can contribute to persistent fatigue. Fatty liver disease triggers inflammation, which can have widespread effects on the body, including contributing to feelings of fatigue. Chronic inflammation is known to interfere with normal cellular functions and can exacerbate the sense of weariness, associated with fatty liver disease. Fatty liver disease can also lead to nutrient deficiencies, particularly in essential vitamins and minerals. At number 7 on our list is weight loss. To begin, let's revisit the fundamentals. Fatty liver disease, or hepatic steatosis, is characterized by an abnormal accumulation of fat within liver cells. Insulin resistance, a common companion to fatty liver disease, also plays a role. As the body becomes resistant to insulin, cells may not efficiently take up glucose for energy. This can lead to increased reliance on fat stores for energy production, contributing to weight loss over time. Fatty liver disease may also lead to muscle wasting or sarcopenia. The body, in an attempt to meet its energy demands, may break down muscle tissue for fuel. This process further contributes to weight loss and can have implications for overall strength and physical function. In some cases, fatty liver disease may be associated with nutrient absorption issues. This can result in deficiencies in essential vitamins and minerals, impacting overall health and contributing to weight loss. If you're experiencing unexplained weight loss and suspect a connection to fatty liver disease, it's crucial to consult with a healthcare professional. Comprehensive evaluations can help identify the underlying causes and guide appropriate management strategies. It's essential to recognize that weight loss associated with fatty liver disease is a complex interplay of metabolic disruptions, insulin resistance, and potential nutrient deficiencies.